Another such system, which is well known in business circles, is the philosophy of adding value. Adding value has been defined as the difference between the price of the finished service, in this case dental treatment, and the cost of the inputs involved in making it. I find this a misleading definition because it implies adding value is always cost based. I'll explain why this is not so in just a moment. For now, all you need to know is that value can be translated into profit for the practitioner and satisfaction for the patient on a variety of frontiers. Not so long ago, a gentleman by the name of Michael Porter developed what he called a value chain. This value chain broke down the activities of any business into 5 primary activities and 4 secondary activities. From these activities, one can derive low-cost strategies and differentiation strategies. The first primary activity is inbound logistics. This refers to all the tasks that have to do with bringing in the raw materials to the practice that are essential for producing your service. This would typically include ordering materials such as gloves, amalgam, fluoride, toothbrushes, and so on. Either way, you typically find yourself dealing with suppliers. Now, I could talk all day about suppliers, but here's what you need to know. You're not always looking to deal with the ones who offer the lowest price for starters. What you want is a reliable supplier who delivers on time and is flexible with regards to your practice needs. You also want a supplier who gives you quality products at a competitive price, a supplier who will give you bulk discounts and rewards your loyalty. Sometimes it's advisable to have more than one supplier to spread your risk, but the idea is that dealing with a supplier must translate into value for you. Now, there's one practitioner I know of who had the very bright idea of approaching a supplier with the backing of his colleagues with the objective of negotiating the price down through some sort of a group discount. They now receive their gloves at a more affordable price, and those few additional rands that they save are available for use elsewhere in their practices, you see. Negotiation now touches on another theory of Porter's. Dubbed the 5 forces, one of which is the bargaining power of customers in a given market. Since the phenomenon of globalization came to being, we are more connected to the world. We have access to our suppliers, which would be their manufacturers and so forth, who are based overseas in most cases. I recently purchased a textbook via Amazon from America, which cost me $90 and got delivered within 2 weeks. That same book costs $1,850 locally. So even at that rate, I bought shares with the money I saved from the transaction and recreated the value. But the point is, though, you have bargaining power on your side. Furnish yourself with information and take advantage of the opportunities presented by globalization. The next activity is operations. Operations has got to do with production of the actual service, turning the inputs into a finalized service, basically. In the case of a dental practice, dental treatment is the core of the service. It is difficult to standardize output in a service environment because of the nature of the offering. Service is intangible for starters. The service environment is dynamic in that the patient first has to interact with your front desk. The receptionist has to be polite, to look presentable, be able to communicate clearly, and must be efficient with regards to checking for dental benefits and things of that nature. If any of these things are amiss, the service will be compromised and value will be lost. The issues go on though. Patients mustn't be made to wait too long in the waiting room. While they are waiting, they must be seated comfortably. Some need to be entertained and others need refreshments like water. Some have children with them who are being troublesome. Others are even afraid of the dentist. Anyway, there's all of this, and before the service has even commenced, you're already trying to sort out all of that kind of stuff. During treatment, it must be said, dental practitioners practice with different levels of skill. Some are simply not as good as others. If you know your strength is not in your dental technique or knowledge for that matter, the weakness has to be addressed. A CPD is one such means, but still, all is not lost. Improving on other parts of your service offering will make up for discrepancies in treatment quality. A child patient will remember the practitioner who gave them a sweet as opposed to the one who pulled out their tooth painlessly. It works like an incentive for them. I'll point out a few other examples of service environment boosters prior to the service being performed. Like, for instance, a smiling and genuinely friendly receptionist. If the person at the front can't receive people correctly, expectations and satisfaction of your service it decreases. An uncomfortable waiting room also reduces satisfaction. Now, I'm not saying buy the finest imported Italian furniture, but get decent furniture. Get an aircon if the practice gets stuffy easily. If your practice is a busy one, you might need a TV to distract waiting patients, a play area for the children, reading material, coffee, tea, and refrigerated water, basically. Banks have mastered making people wait while standing even. Now, you can possibly do it while people are seated, The idea, once again, is to identify where you can create value through customer satisfaction. The most obvious return you'll get from a happy patient is repeat business and referrals through positive word of mouth. This is without investing monies towards marketing. That's value creation. Outbound logistics is the next activity. This would usually refer to the delivery of complete products to retailers, but since the service is manufactured and delivered within the same premises, in the context of a dental practice, this can refer to tasks such as sending work to dental technicians or even referring patients to specialists with a view to treating them once again. Some practitioners like to pay the technicians up front and claim a surplus from the medical aids. I'm not 100% sure if that's best practice, but I'll take this opportunity to quickly point out something about specialists. They need referrals more than any other type of practitioner. In the interest of improving your patient satisfaction, why not possibly negotiate lower rates for your patients in return for referring to one specific specialist? The underlying value is obvious here, and it's earned at no cost, basically. Marketing and sales is the next activity. This refers to all activities that have to do with promoting and selling the practice and its services. The HPCSA has guidelines regarding the extent to which a practice can advertise. It's always best to stay within the advised scope. I've run into a lot of practitioners who don't know if they're allowed to have websites for their practices. Well, yes, you are. Just don't overdo it. And I believe they don't want you to show any pricing or something of that nature. In this activity, direct forms of value can be offered. That's marketing, right? Through promotions like free consultations and discounts, for instance. Moreover, marketing helps you position your practice to attract the kind of patients you want. For example, if for some reason you decide that you're no longer accepting medical aid cards at your practice, you're implying that you accept cash only for starters. You need to communicate that to your market. You need to let them know that you have a speed point, you accept EFT payments and direct deposits strictly or something. Anyway, in marketing circles, they commonly like to refer to the marketing tactic principles, which are aimed at customer satisfaction as the 5 P's of marketing. The first P is the product. It stands for product. This refers to the communication of the features of your service and the benefit which your patient stands to gain from choosing your practice as opposed to another. In other words, what makes your practice so special? I'm going to ask you that again soon. The second P is price. This refers to your pricing strategy and how it will affect your patients. You need to know how much the people you are targeting are willing to pay, how much you need to cater for your overheads. I'll take some time to point out that it's always wiser to have 3 prices in any business. In the instance of a practice, you can offer the medical aid price, the normal cash price, and a special price for those who sign up on a dental plan. Dental plans I'll discuss thoroughly in another presentation. The third P is promotion. This includes activities aimed at advertising, sales tactics, and direct forms of marketing. You would typically choose the medium which you would like to use to communicate to your market according to their segmentation on the living standards measure. What I mean by this is that you would not use the internet to target people who fall under an LSM level, which typically consists of people who have no access to electricity, for example. Don't get a website because everybody has one. Make sure it makes sense for your practice and the kind of people you typically attract there. The fourth P is place. I've already emphasized that in a service environment, the product is literally produced and consumed in the same place. The the way your practice looks and the degree of comfort one can obtain from it just it just might be the difference in towards satisfying a patient, basically. The fifth P refers to people. This refers to your staff. When an excellent service is provided, you market your brand to the patient in a positive light. Naturally, the kind of patients you want to attract should be the kinds of patients that want you. If your patients are satisfied with your service, not only do they come back to you, but they also generate positive word of mouth, which, as far as value goes, is actually invaluable. After sales services is the last primary activity. This refers to everything that happens after the patient has been treated. Take this for example. When you service your car at any car dealership with its fault, you'll usually get a call, SMS, or email to rate their service. If a dental practitioner did that for every patient, even a dissatisfied patient would be pleased because it shows that practice actually cares. Other examples include sending birthday SMSs, good wishes during religious holidays, buying from your patients who are also in business. I know of a practitioner who gives his patients who come from afar petrol or taxi fare for their efforts. It might sound foolish, but they always come back. Small things like that, they go a long way in creating value. Now, these primary activities